So for today's setting, good day, ma'am. I am Mala Choi Leite, first year nursing student at Notre Dame of Tacloban College, College of Nursing. So today I'm going to perform my written demo about assessing the musculoskeletal system. So what are the equipment we need? We only need percussion hammer. So first, procedure, assess the client's physical and psychological aspect before and during examination. Rationale, allows healthcare provider to gather complete data about the client's health status. So sir, okay lang po ba kayo na yan?
Okay lang.
Next procedure, review the body areas to be examined. So sir, we're going to examine your health, your muscle structure. Rationale, helps examiner identify which part of the body is to be examined systematically. Next procedure, make a physical and environmental preparation before examination. So let us assume that we are conducting in a proper environment. Rationally, this proper preparation of the environment, client, and equipment ensures smooth physical examination with few interruptions. So next procedure, determine and prepare the materials, equipment needed. So we already have the equipment. So let's us identify the client. Rationally, this is to ensure that the procedure is done to the right patient and to reduce anxiety and promote cooperation. So sir, I am Mala Choi, your nurse for today. So, ano pong pangalan nila?
Shannon Dong.
Sige, sir. Next is procedure number 6. Explain the procedure to the client, and rationale, this is to explaining the procedure to be done reduces anxiety. So sir, I'm going to assess your musculoskeletal. So for me to assess you, can I ask your consent to touch your certain parts of your body? Okay, thank you, sir. So next procedure, properly position the client. Sir, so po tayo ng mayos? Sir, opo. Rationale, proper positioning ensures easy access to the body parts to be assessed, and clients feels comfortable.
I'm comfortable.
So take the health history of the client. Rationally, this is to have a comparison with previous illness and prevent previous illness or illnesses and prevent health conditions. So sir, sa family niyo po ba, do you have illness or disease
Wala.
related to your parents or your grandparents or your grandparents?
Wala. Wala.
Okay po, sir. So, next procedure, conduct physical examination using the 4 skills in physical assessment, which is the inspection, palpation, percussion, and auscultation. So, rationale, this is to assess, determine, and identify the abnormal findings in the body system. So, let's proceed in the first procedure, the inspection. We're going to inspect the muscle for size, compare the muscles on one side of the body to the same muscles on the other side. For any discrepancies, measure the muscles with a tape. So, let's check, sir. Okay. So, rationally, equal in both sides of the body. So next procedure, inspect the muscles and tendons for contraction. Contraction. Rationale, no swelling and no contraction. So sir, let us check, sir. Okay, next procedure. Mm, 12. Inspect the muscles for tremors.
Tama rin.
Yan, tama nga din. Ang sabi ko. For example, by having a client hold the
Kasi tao.
procedure 12, inspect the muscles for tremors, for example, by having the client hold the arms out in the front of the body. So, sir? Ay. Okay. So, rationale, no tremors, yeah. So, next procedure, we're going to test the muscle strength, compare the right side with the left side. Taas pa natin kamay mo, sir. So, tingnan na po natin kung okay po, sir. Same no? Tingnan na po. Next procedure, sternocleido. Okay po. Sternocleidomastoid. Client turns the head to one side against the resistance of your hand and repeat the other side. So, sir, stand po sa resistance. Okay po, sir. Next po, sir. Okay po, sir. And next procedure, trapezoids. Client shrugs the shoulders against the resistance of your hands. So, sir? Shrug po, sir? Ay. Shrug, sir. Okay, sure. And next procedure, deltoid. Clients hold arm up and resist while you try to push it down. Sir? Sir? Sir, thank you. So next procedure is biceps. Client fully extend each arm and tries to flex it while you attempt to hold arm in extension. Sir po, sir. Kabila po. So next, triceps. Client flex each arm and then tries to extend it against you attempt to keep arm traction. So, sir. Thank you po. So next is F. Wrist and fingers muscles. Client spread the finger and resist as you attempt to push the fingers together. Okay po. So next, grip strength. Client grabs your index and middle fingers while you try to pull the fingers out. So, sir.
Index finger.
Kabila naman po, sir. po. So next procedure, hip muscles. Hip muscles, clients is supine, both legs extended, client raises one leg at a time while you attempt to hold it down. So sir, higa po tayo. Sir, sir, supine po sir. Po, kataas po. Sa kabila po. Kataas po. Okay po. Next procedure, hip abduction. So, client is supine and both legs extended. Place your arms on the lateral surface of each knee and client spreads the legs apart against your resistance. So, sir. Sir. So next procedure, hip adduction. Client is in the same position as your hip abduction. Adduction, place your hands between the knees, and client brings the legs together against your resistance. So dito. So resistance. Stand po, sir. Okay. Next is hamstrings. Client is supine. It is the same position and both knees bend. Clients resist while you attempt to strengthen the legs. So next, next procedure, quadriceps. Clients is supine and knee partially extended, and knees is partially extended. Client resists while you attempt to flex the knee. Okay, come. Next procedure is muscles of the ankles and feet. Client resists while you attempt to dorsiflex the foot and again resist while you attempt to flex the foot. Flex the foot. And the normal result, it should be no tendons and equal strength on each body side. So, next procedure, we're going to inspect for skeleton, for structures of sir. Rationale, no deformities. So, harap po, sir. Okay po. So, no scoliosis or lordosis or kyphosis. Sir. And next procedure, we're going to, for the palpation, palpate the bones to locate any areas of edema or tenderness. And next procedure ay it should, nationale or normal result, it should be no tenderness or no swelling. Masakit po ba, sir?
Wala naman.
Ako po dito, sir. Okay. So, next procedure, we're going to inspect and palpate joints for tenderness, smoothness, or of movement, swelling, crepitation, and presence of nodules. Nationale, no swelling, tenderness, and no nodules. Wala naman pong masakit, sir? Okay po. So, next is neurological. Percuss the bicep reflex. The patient's elbow is slightly bent forward while your arm is supporting the patient's arm. By placing your forearm by placing your forearm diagonally underneath the patient's arm, strike the biceps tendon with a percussion hammer. So, sir, hammer po, sir. Ano po? Kabila.
Kita mo pamimura kita rin.
So next procedure, percuss, no. Rationale, the contraction of the biceps can be seen and felt. Next is percuss the triceps reflex. The patient's elbow is lifted and bent while hanging freely with you, hand supporting the patient's arm by holding the distal humerus and strike the triceps tendon. One thumb from the body prominence of the elbow using the percussion hammer. So, sir, may po. Dito po sa kanila. So, next procedure, percuss the rationale, the contraction of the triceps can be seen as the elbow extend. So next procedure, percuss percuss the knee. The patient is in the sitting position. The patella is struck with the percussion hammer. If the patient is lying down, the reflex is tested while the examiner hands are placed under the knees to bend them. So, sir. Kabila. So, rationale, the contraction of the quadriceps causes the knee to extend. So, next procedure, percuss the ankle. The leg is bent at the knee and the foot is supported in walling position. The Achilles tendon is struck with the percussion hammer. Sorry. Tapos lang po natin, sir, ang pants niyo po. Okay. Rationale, Rationale. The foot jerks and moves downward. Next procedure, percuss the plantar. And percuss the plantar reflex. The lateral aspect of the sole of the foot is stroked with an object. Stroke the lateral border of the sole the client's foot, starting at the heel, continuing to the ball of the foot, and proceeding across the ball of the foot toward the big toe. So, rationale, the toes bend, the normal findings or rationale is the toe should be bent or curled. Next procedure, we're going to reposition the client. Rationale, this is to ensure that the client is, this is to ensure client's comfort. So, sir, po ba tayo na mayos? Comfort na po. So, evaluation, making findings of the health assessment and physical examination done on the client. Rationale, this is to convey to the this is important data to convey to the physician to aid in diagnosis of the patient. So next procedure, we're going now to documentation, record, document, and report any pertinent findings found during assessment to appropriate personnel. Rationale, to provide accurate data in the care of client. So that is it all to the